First of all, I'd like to welcome everybody that is joining us live, and if you're viewing this after as well. So welcome to our live Q&A on the COVID-19 vaccine and the pandemic in general. I'm your host, Jordan Cryderman. I'm part of the Communications Department at Carey Scanning Family Services. This is our second one. We're hoping to go a little bit longer this time than the first one. The first one was a little short, and there's a lot of questions out there, so we'll try and answer as many as we can today. We are scheduled for an hour. And so first of all, I'd like to thank the land that I am located on today. I'm on the unceded territory of the Lheidli T'enneh, and I invite everyone that is watching to also reflect on the land that they're presently on and the gratitude that we share for the lands that sustain us all. So joining us today, we have Dr. John Pawlovich, Shannon Douglas, Dr. Rakel Kling, and Dr. Terri Aldred. And so why not, we can just get started. So I could just ask everyone to unmute and we can get started.
Thanks, Jordan.
Okay, so first question, what is the COVID-19 vaccine? And maybe what we'll do is we'll kind of just go, I'll ask Dr. John first, and then if someone wants to add something to his answer, then we'll go from there. And then second question, I'll ask Shannon, and just to keep it orderly. So Dr. John, maybe if you want to start, what is the COVID-19 vaccine?
Sure. So I'll give the simple answer. I'll leave the more sophisticated answers for the really smart docs on the call here, Jordan. So sometimes it's easier to think about that question in the reverse way as to what isn't the COVID vaccine. And what the COVID vaccine is not is COVID virus. And so a common question that always gets asked, can you get COVID from the vaccine? And the answer is absolutely not, because there's no virus in the vaccine. Unlike other vaccines that we have out that we use in healthcare that have parts of viruses or live virus or partially live viruses. So the vaccine falls under, in medical terms, it's this messenger RNA vaccine, but really it's a vaccine that gives your body kind of the computer program, if you will, to make a part of the COVID virus that we've all heard about in the news called the spike protein. And then your body reacts to that and creates its reaction that causes these things we call antibodies in your body, which I try to describe to patients as we create a little army in ourselves to help fight COVID. And the whole idea is to build an army in our system that will respond to the COVID virus should it be presented to our bodies. And really that's kind of the simplified version of it. I'll let maybe Dr. Shannon, pass it over to her to add to that.
Absolutely.
Yeah, I think you captured it really well, John. It's, the COVID vaccine is a vaccine like most others. It's an injection that people would get into their arm, and it helps your body kind of build up a defense to the COVID virus so that after you've had the vaccine, if there's COVID virus in your vicinity, or if it kind of comes into your body, your body is able to mount a defense against that so that you don't get sick with COVID.
Great. So, and does anyone else have anything to add? No. Okay. So that kind of answers the next question, that why is it so important to get a vaccine? But maybe on top of that, why is it important not just for yourself, but maybe your community as a whole? So maybe Rakel, you'd like to answer that, or?
Yeah, sure. So this vaccine is so important to get because, like you're saying, this vaccine is important not just for protecting yourself, but protecting your families, your friends, your community, and yeah, it's extremely important. So what we do know is this vaccine is very good at preventing, real significant disease, hospitalizations, and deaths. And so that's why it's so important that we have this vaccine, just to protect everyone around us, to keep everyone healthy. Some things that we don't know, though, around the protection that this vaccine gives. what we're still learning is if the vaccine, if getting the vaccine means that we can't pass COVID to other people. So that's what we don't know yet. We actually do think it is possible to pass COVID when you've had the vaccine. You might have some very mild or non-noticeable illness, even if you've had the vaccine, and you might still be able to pass it on to someone, especially someone who hasn't had the vaccine. And then that's putting them at risk. So that's why it's just so important that everyone, as many people as possible, get the vaccine, and it's gonna really help to keep like ourselves, our families, and communities safe and out of healthcare.
Absolutely. So it kind of it helps the strain of the whole pandemic on the healthcare system as well. Is there anything that anyone else would like to add to that?
I would just add, Jordan, there was some interesting information that came out of the news. People may have saw it in the last week around one of the vaccines that's not in Canada, the AstraZeneca vaccine, showing some encouraging results around the transmission post-vaccine, and showing a significant reduction in those people in that, answering that question that Rakel talked about. Can we continue to transmit it? So I think, again, as we go through this pandemic, as more and more people are immunized around the world, a lot of these questions will develop more clarity around these questions about, how long does immunity last? Can you still transmit the virus to others in a community spread way? I think what Rakel touched on, that was really, really very important to emphasize, is that even if you get the vaccine, even if you get COVID after the vaccination, what we're seeing is that people get a really, what we call in healthcare, attenuated or dumbed down kind of experience with the illness. So you're in the trials of the people who got, over 30,000 people who got vaccinated, only one person got seriously sick, and nobody died. And that's a really important part to emphasize. So your chances of getting seriously sick after being vaccinated is extremely, extremely small, and nobody died in the trials. And we know in the world, there are over 2.2 million people have died worldwide from COVID. Over 20,000 people in Canada, and in BC, over 1,200 people now have died from COVID. That's what we know, and that kind of dashboard number is alive and well. Everybody can look at it provincially, nationally, or internationally, any given time of the day. And so, when you think about that versus people who got the vaccine and no one died, I think there's a clear message there.
Right. Absolutely. So we got a question from sorry if I'm saying that incorrectly. Does this vaccine also work with the different variants of COVID? So, of course, we all know that there are a couple variants that have been reported in the news of the COVID-19 vaccine, such as the UK strain, and I think there's like a South Africa one. Does the COVID vaccines that we have in Canada, do they protect from those variants? And then maybe Shannon, you'd like to answer that one?
Yeah, I'll take a first stab at it.
Sure.
The COVID-19 virus is moving through populations, and there are new mutant strains being developed all the time in different areas of the world. It does seem like our current COVID-19 vaccines provide some protection for some of the strains, but we don't have a full picture yet. And we don't know if they're going to protect fully or to the same level to all of the strains. And we don't know about future strains that may come. Rakel, I think you would probably be well positioned to provide a little more input with this.
Yeah, I think the amount that the vaccine protects against the various strains is still something we're very much learning. It's very new, these new strains, and we still don't understand everything completely. And I think that's something we're very much still, looking to understand. And I think I just need to add here, and this, applies to this question and to others that we've already answered, is that, this is, because of the new strains and the unknowns, what's going on with the new strains, because of the unknown of whether the vaccine can prevent people from transmitting COVID. It's extremely important in all instances, whether you've had the vaccine or not, whether you've had COVID or not, it's still so important to still follow all of the, advice, guidelines, orders, and recommendations from all the health professionals. We still need to distance, masks, keep to our household bubbles, and that's the best thing that we can do. And the vaccine is, hugely important. Like we've said already, the vaccine is really going to help, people from getting really sick from COVID, but we still don't know what's going to go on with all of this in terms of how COVID is going to get spread over the next while. So we know everyone's tired of all the advice. Everyone wants to gather and, do all the things that we used to do, but it's just still not the time for that.
Absolutely. And did anyone else want to add to that? I think we're good. Okay. So now we have, she said her name was Melissa. So she says, can people take the vaccine if they have underlying health issues? And I think Dr. Terri said she had to step away for a minute, or do you want to answer that?
Yeah, I can answer that before I, step away for a sec.
Absolutely.
So for people with chronic health conditions, it's absolutely recommended to get the vaccine because we know that people who do have underlying medical conditions like diabetes or high blood pressure, asthma or chronic bronchitis, things like that, do have a worse prognosis if you were to get COVID. It's even more important to get the vaccine to help prevent becoming more sick or potentially dying from COVID. So we do absolutely recommend that you get the vaccine if you have underlying medical conditions. And if you have questions about your particular case or set of health conditions, don't hesitate to reach out to any of us with the Caris County docs, or if you have another primary care provider to ask questions.
Great, thank you. And did anyone else want to add to that? No? Okay. So this wasn't a live question, but this is also a question that I have seen before. Should pregnant people be taking the vaccine or be getting the vaccine? Maybe we'll go to Dr. John for that one.
Sure.
Okay.
I'm not pregnant though, Okay. So I might not be the right person to ask. But it's not recommended at this particular time. Having said that, there's a lot of data that's emerging around this, but it's we don't recommend vaccinations at this point for pregnant women, but that can be a conversation between patients and their healthcare provider who's helping them with their pregnancy. It's not that it's those people just weren't included in trials, and so we don't know the answer to the questions. But again, more evidence will be emerging around what that might look like, and as Terri put in the chat here, things are changing quickly.
Gotcha. And did anyone else want to add to that?
I guess I will add that right now, those who are breastfeeding are still recommended to get the vaccine. And so, I just thought I'd add that.
Perfect. So,
sorry,
go
Jordan,
ahead.
I would just add one more thing. I don't think there's any evidence that the vaccine is harmful in pregnancy. So if anyone has received the vaccine and subsequently finds out they're pregnant or is having a lot of anxiety about that, I think we can kind of rest assured that there's no we don't believe the vaccine causes a problem.
Great. Okay. Yeah, I think that's very important to address. So thank you for doing that.
And Jordan, sorry, I'll just add to that a little bit. That's a common question about whether you're pregnant or whether you have diabetes or you have heart disease. And over the last number of weeks, fielded lots of questions like this, and as Dr. Shannon articulated well, it's not a safety thing as far as we know. A lot of these questions our thinking is around, will people mount an immune response to the vaccine in a way that will be helpful and protective? And we don't know the answer to that. But undoubtedly, the vaccine is so safe because there is no virus in it, and that's okay. One of the special qualities of the mRNA vaccine that makes it so safe.
Gotcha. Okay, so Miranda Thomas asked, if you already had COVID, when can you get the vaccine? And I guess part of that as well is, if you currently, or if you've recently tested positive for COVID as well, can you get the vaccine? So two-parter. Maybe Rakel, you'd like to answer that one?
Sure. Sorry, what was the question again?
Oh, no problem. So Miranda Thomas, she asks, if you already had COVID, can you get the vaccine, or when can you get the vaccine? And also, if you are either currently positive or very recently positive for tested COVID, positive for COVID, sorry.
Sure. So yes, absolutely. If you've had COVID, you should still get the vaccine. We're still learning, like Dr. John said already, we're still learning about how immunity works, with COVID and how long it lasts for. So, we don't think it lasts indefinitely. There is a time where, after you've had COVID, that you might not be immune to it anymore. So it's still very important that you get the vaccine, even if you've had COVID. And right now, what we're recommending actually is that we're going to be waiting 3 months after you've had COVID to get your vaccine. And that's because we know we're still learning about how long immunity lasts, but we're quite confident that once you've had COVID, your immunity lasts for at least 3 months or longer. So that's why we're just recommending waiting the 3 months. It allows us to get a few more doses out to people, knowing that you yourself will be well protected until the 3 months is up.
Great. And did anyone want to add to that?
No, I would just add, Jordan, there are also a lot of questions for everyone, doctors and healthcare workers included, around, we all are experiencing in Canada this kind of stuttering of the vaccine coming to the country. So we're getting some, and then we're not, and then when are we getting more? And there's a lot of anxiety and questions around that. And as people who got their first injection, and with the trials, there was a very, a set amount of time that lapsed between the first and second dose. And now, because of the way the real world plays out, the timing of that second dose is in question. And so that creates more questions for all of us. But again, just doing some reading in the last day or so, again, there's emerging evidence around, as what Rakel talked about, we're learning about how protective even a first shot is. And it's probably longer than what we think. And traditionally, not talking about this vaccine, but other vaccines, actually spreading them out over a number of months actually proven to be quite protective. So we're going to learn about that, but the signals is that it doesn't appear to be any less effective, say if you get it a week or two after the up to the 42-day kind of period, if that makes sense. I don't know if the other docs have anything to add to that.
Thanks, John. I agree. This is evolving, and we're going to have much better information in time. I guess just to answer back to Miranda, it is true. We're recommending people wait until their age cohort, at least 3 months after a diagnosis of COVID. There are people who have been exposed to COVID. Everyone in their family has gotten COVID and they haven't gotten a positive test. I think one of the things to remember is that this isn't about vaccine safety. And if you receive the COVID vaccine shortly after COVID, it's not that it's harmful. you don't need it because you have a certain amount of natural immunity. And so we're asking people to delay until about 3 months after their infection and with their age cohort.
Okay. Did anyone want to add to that? Okay, I think we're good. So Lawrence Crow is asking, like the yearly flu shots, are we going to have to get yearly or more shots other than the booster for the COVID-19 vaccine?
I sure hope not. But I don't know the answer to that. And that is a big question that everyone's answering. We know that things like measles, we get it and we're good for just about our whole life. Sometimes we get a booster later on in life. Sometimes some vaccines, you'll see the doctor and they'll send you to the lab to get a test to see how your immunity is still doing. And so just the easy answer is we don't know the answer to that question yet.
Okay, gotcha. And did anyone else want to add to that? All right. So Dwayne Casimil is asking, is there a potential date for vaccinations in our area? So I guess more related to our Canada's plan for distribution. Now, I know this is more of a FNHA question, and unfortunately we don't have anybody from FNHA today. But if anybody has kind of some more insight into that, that maybe they can speak to, that'd be great.
Yeah, I don't think any of us have, any certainty about that. Jordan, I think it's fair to say over for the rest of the duration of February and into March, we're probably going to see vaccines trickle in. It seems to be, for all of us hearing what we hear, not knowing what's going to happen, is that come the spring, come April, we are going to get a sizable shipment of vaccine, which then will turn out kind of a rationing strategy, if you will, being very selective to mass immunizations. And so when the needle swings to everybody getting it, and how we're going to do that'll create new questions and new challenges. But we anticipate somewhere in the spring that transition is going to happen, I would think. Okay. But I don't have crystal ball at all. So
yeah. And did anyone have anything to add to that? No? Okay. So let's see, what else we got here? Valerie Rose is referring to a question about a person that is allergic something unknown, that has had anaphylactic a couple times. They have an EpiPen, so they have allergies and are worried about the vaccine. Is there anything, can we speak to that at all?
I can jump in if you want. Yeah. Having been involved, personally with some vaccine delivery days in some of our communities, common question. People have allergies to shellfish and to many things. Really, when you get, it's a very safe environment to get the vaccine. So the teams have the appropriate medication to deal with serious allergy should they arise. And people who already have a declared severe allergy are obviously have the heightened level of scrutiny for when we give the vaccine. Having said that, there's a clear list of ingredients that are in the vaccine, and should you have one of those ingredients, that would be a reason not to get the vaccine, and otherwise, you'll be observed closely like everyone after you get the vaccine. And so having seen a lot of people with different allergies, and nobody that I came into contact with had any significant reactions at all to it. But this is a common question around the world. Doesn't matter where you are. Allergic reactions happen. They happen every day to a whole bunch of medications, including vaccines. And so the medical teams that are prepared for this eventuality should it happen, Jordan.
Okay, so if somebody does have an adverse reaction to it, that is quite rare, that there are people on standby that know how to deal with that kind of thing.
Yeah, I think it's a great question as to what happens when you get the vaccine. You know, the main thing is you get a sore shoulder, and you know, sometimes you get red and a little bit swollen there. But in terms of having a severe life-threatening reaction, that's very rare. Yeah. Again, it will be dealt with, you know, appropriately, like any severe allergic reaction should it happen. And then beyond that, you know, other common side effects are, other than the sore shoulder, achiness, feeling a bit fluish after the vaccine for a period of time. And this from what the experience has been, you know, that can even be more pronounced after the second shot, that kind of feeling of kind of fluish achiness, headaches, that kind of thing. It dissipates very, you know, quickly within a day, you know, 2 at the most kind of thing. And again, any questions after you've had a vaccine about how you're feeling, medical teams, your doctor's team can connect with you at home and help answer that question. The other great line in Northern Health, of course, is the COVID line, who people can always reach out to with any questions about anything related to COVID, including vaccines.
Absolutely. And does anyone want to add to that?
And I also give a pitch to the FNHA Doctor of the Day program, in addition to local healthcare teams. Always the best group to go to are your family doc and their clinic and their team. But sometimes things happen after hours or between times when local, you know, family docs are available. So these are just other teammates, if you will, in the healthcare space in Northern Health that people can reach out to.
Absolutely. And once I get through asking the next question, I'll put those numbers in the comments for everybody. So Leslie Russell, she's asking, do they need to stop breastfeeding for a time? I guess this is going back to a question that we already asked, that maybe she joined a little late, that maybe Shannon would want to just retouch on, that it's safe, we think.
Yeah, the COVID vaccine is safe with breastfeeding. You cannot get COVID from the COVID vaccine, and you cannot get COVID and give it to your baby with the COVID vaccine. So the vaccine is quite safe with breastfeeding.
Great. Okay, thank you very much. And okay, so Shirley Babcock is asking, sometimes my allergy reactions happen up to 18 hours later. Will people be around still? So I guess she's saying she's gone home after the fact of maybe some other vaccines that she's had and had allergy reactions then. So what should someone do in that case? So maybe Rakel can answer that one.
Sure. Sorry, you keep catching me distracted.
That's okay. So Shirley Babcock is asking, sometimes she's had allergy reactions 18 hours after, I guess, a different kind of vaccine. What should someone do then?
Yeah, really good question. Usually, in order to not have someone have a vaccine, we need to demonstrate that they had a specific reaction to the vaccine they're getting. So, but I do think that this is a great example of a conversation that you should be having with one of your primary care providers and discussing if it's appropriate to have the vaccine.
Right.
And then Jordan, I might add to that, you know, having follow-up after the vaccine, these are all things that can be organized for patients should they have any specific needs around this. And so again, I wouldn't let that particular scenario prevent somebody from getting a vaccine. It's just a matter of creating a strategy to support that individual after they get the vaccine to ensure they're safe.
Right. And so some people are wondering, such as Charlie, are wondering if the vaccine is mandatory. It's mandatory that you get it. And maybe Shannon could talk to this point.
Yeah, the vaccine is not mandatory. We are strongly recommending it, but it is not mandatory.
Right, okay. Sharon Monk is asking if can we get COVID more than once? Yes.
So it's Raquel, maybe I'll just elaborate. Like,
sure.
Dr. Shannon and Dr. John are saying yes, but
Yeah.
at this point, it's quite rare, actually. There's only a small handful of cases documented in BC where that's happened. But like I said, absolutely, it's still something that we're still learning about. COVID is still very new, and there's still lots that we don't know. So we think certainly in a short time frame after you've had COVID, it's very unlikely to get COVID again, especially in that 3 months after you first had COVID. There's pretty much no chances that you're going to get COVID again. Beyond that, we don't know, and we're still learning. It's possible, but at this time, it's rare. Although that doesn't mean that you can still go be in contact with other people, be in contact with other COVID cases. It's still important that everyone follows all of the rules and guidelines, just because we still don't know all of these things yet.
Right. And does anyone have anything to add to that?
No, that's Raquel said that really well, Jordan. It's understanding how our immunity lasts, either after vaccination or natural infection. These are the questions which will, once we know more, will help answer the questions around, can you get this? Will you likely get this at a later time? If your immunity stays strong, indefinitely, it's going to be low probability. If we start to see the immunity tapering off after a certain time, people will obviously become more vulnerable potentially. So,
right. And kind of related to that, I know we don't know a lot about the variants that are coming into BC, but is related to that previous question, can you get those variants if you've already had COVID as well? So again, we don't know a whole lot about them, but I would have, yeah, maybe Rakel.
I think we just don't know yet still. Yeah, it's too new.
I would say, Jordan, again, one of the concepts we talk about in the vaccination rollout is the herd immunity. We get up to 7 out of 10 people vaccinated, 70% that is, and that creates a protection of a population. And obviously, the more that get vaccinated, the more protection there is for the people who haven't been vaccinated. And I think the story around the mutations that happen, eventually, for example, if we had 100% vaccination rates and people were abiding by the other protective behaviors that we know, hand washing and social distancing and wearing masks, we essentially would halt COVID in its tracks, and it wouldn't be able to mutate anymore because it wouldn't hop from person to person. And it's the hopping from person to person in big populations that allows it to undergo these mutations and become more dangerous. And so the idea of, again, encouraging more and more people to get vaccinated is to prevent the human to humans transmission, and as well as doing these behaviors. And that is the way the pandemic is going to come to an end. And so that's the message that, if I had to leave one sentiment with the listeners today, is around to get out of this pandemic, we have to halt the virus from doing what it's doing now, which is going into nursing homes and wiping out up to half a population. All right. So through vaccinations, and the higher we get to, above 70%, and the more of these really important behaviors are done, this is when this pandemic will come to a close.
Right. Absolutely. And does anyone have anything to add to that? All right. So maybe for Shannon, are we able to test for these variants, to test if they're in our communities, or do we just learn from outside sources? Yeah, I'm not really sure how we are able to detect these variants.
Yeah, that might be a better question for Rakel.
Okay.
It's my understanding that a certain number of the swabs collected kind of from across the region, across the province, are tested, but not every COVID swab is tested for variants.
Gotcha.
I'm going to pass it off to you though, Rakel.
Yeah, and I'll have to clarify this, but I feel like I read some sort of NH note somewhere yesterday that said that we can detect if a case is due to a variant in Northern Health, but we can't differentiate what kind of variant that is, and that would have to go to BC CDC.
Okay, so it's not like you get the test and it just pops up on the screen, oh, it's the UK variant. Yeah.
And Jordan, I think people have also heard in the last few weeks, there's been a lot of talk about the federal government and restricting flights from outside of Canada. And again, as a way to minimize the entry of variants into the country. And so now if you come from Europe or Asia and you land in one of the designated, you have to land now in a designated airport, I think Vancouver, Calgary, Toronto, Montreal, maybe one more. You actually have to have a COVID test, right. And you have to isolate in a defined facility at your own expense. Right. And so there was a question about, do you have to have the vaccine? The answer is no, but for international travelers, you have to be tested for COVID. It's not an.
And so what is so scary about the variants? I know it's still COVID and it's still very serious, but there seems to be more alarm around the variants. Why is that?
I think the biggest, I wouldn't say it's alarm, but I think the biggest unknown with the variants is I think we're still learning that, the variants might lead to like increased transmissibility. So, okay. Whereas, one person infected right now with COVID, you pass it on somewhat readily, but not incredibly readily. Whereas there's some fear that the variants, you could pass it along far more easily than the current strain. Okay. And that just then has a lot of implications to, our healthcare system. If more people are getting COVID, then, do we have the resources in place in our healthcare system? And, from a public health side, it just means we need to be doing, really good case management and contact tracing, and there's just a lot of unknown implications that we're still learning about.
Okay. And we have Ashley, I'm going to butcher this last name, I'm very sorry, Zaworski, is asking their 2-month baby got COVID, if I'm getting that correct. What would be the lasting effects on a newborn if they got COVID? Maybe Dr. John, Shannon?
The truthful answer is I don't know.
Yeah.
I would have to reach out to, and I don't think anybody has the answer to that question. But our pediatric medical peers would have a better response to the question. What I do know is that people under 20 years of age, the risk of having a serious, illness with COVID is low.
Right.
And so, but there are potential dangers for for infants and children and so forth. But in terms of long-term effects, I would have to defer to my pediatric colleagues on that one. But again, because we just crossed the anniversary of the arrival of COVID in this country a couple of weeks ago, we are not going to know the answers to those questions for a long time. In the years ahead, we'll start to understand these things.
Yeah, absolutely. And does anyone, Dr. Shannon or Rakel, would like to add to that? No, okay. So one of the questions that people have been worried about is we were able to develop this vaccine so quickly. So how do we know enough that it's not dangerous, basically? And maybe Shannon would like to answer.
Yeah, thanks. So this vaccine did come together really quickly. We had the building blocks for the vaccine before the illness came, so we had a little bit of a head start. But the vaccine, there was tremendous amount of funding and people involved and invested in finding a vaccine from across the world with international collaborations on vaccines. And so the vaccines were developed, remarkably fast. I think when we have our brightest people from around the world focusing on a global problem, we can get solutions fairly quickly. The same rigor that has been applied to all of our other vaccines was applied to the COVID-19 vaccine. It went through each of the vaccines goes through multiple stages of investigation where they look at safety and effectiveness, and including quite large studies where like tens of thousands of people have received the vaccine. And then all of that information is reviewed rigorously by different agencies around the world. In Canada, it would be by Health Canada in order to be approved in the country. So, when I look at this vaccine and how fast it came through, it is really remarkable. But I think it's more a testament to just the collective will and ambition of people around the world kind of focusing on a big problem, more so like it wasn't people cutting corners. It was just people were all working together and collaborating.
Right.
Jordan, I just want to echo and emphasize Shannon just said it perfectly. Just as an example, in normal trials of different medications and vaccines, just the finding the people to vaccinate in a trial, okay, the participants, that is what I'm speaking of, takes a long time. And for these trials, there was no problem. In fact, it was so accelerated. People were putting their hands up saying, I want to be in this trial. I want to be in this trial. And so that kind of process, which can play out a long time to try to get enough people to participate in a trial, we didn't have the companies that were involved in the vaccine trials had absolutely no problem, encouraging people to join in and be part of that.
Right. That makes total sense. And Rakel, did you want to add anything as well? All right. So for the next question, we got Frank Wolf Mitchell is asking, how does one get anything for the pain after COVID? He's saying his cousin had COVID, but is still in pain after the fact. So is there anything that can be done for that?
So I can jump in. So there are a whole bunch of symptoms people can have from COVID. Pain, some people get post-traumatic stress disorder, some people have fatigue. There's a phenomenon that people I'm sure have heard on the news called the long haulers. So people that kind of drag symptoms of COVID weeks, months down the road.
Right.
And so as a result, there are these kind of post-COVID clinics that are emerging to help people who are suffering from the lasting effects of COVID. And I would encourage anybody, whether it's kind of chronic shortness of breath, whether it's you are on a ventilator in the ICU for a long period of time, and now you have, anxiety at night when you go to sleep, whether you have pain, it can be a whole number of things. And I would encourage you to talk to your family docs that you belong to, and there are these specific clinics. And I know Shannon and I were involved in a medical staff meeting yesterday, and looking at hopefully in the north, one of these clinics will start to emerge. But certainly through mechanisms such as what we're using right now, through a video platform, we should be able to connect patients to these specialized clinics wherever they are over time, to help patients with kind of these chronic symptoms from COVID. I don't know if Rakel or Shannon have anything to add to that.
Thanks, John. I guess the only thing that I would add is that the first stop for this is your primary care provider. So either your family doctor or your family nurse practitioner.
Gotcha. And Rakel, you didn't have anything to add? Okay. And so I think that is pretty much the end of my list here. And I don't think there's any more questions on here. Perhaps there's any frequent questions that you have heard that maybe you would like to address on here that we haven't yet. So maybe we'll start with Dr. John if there's anything that comes to mind.
No, I think, Jordan, you thanks so much for hosting us and asking the questions. There are excellent questions. There are common ones that I've heard over the last number of months, really, even before the vaccinations started. And I really want to encourage people to keep asking questions and to reaching out to their care teams, to their family docs, to their nurses at Caris County, Northern Health. We're all here to help answer these questions, and every question is a good question to ask and to reach out for an answer to. So thanks for the privilege of being involved today.
Of course, thank you for joining. And Shannon, did you have any common questions that you'd like to address?
Yeah, I guess the most common thing that I would hear is that people are a little bit anxious. They're a little bit nervous about, what's the vaccine going to look like? What's it going to do to me? And I think this is a really good time. We've got a few months. We should be, as John says, asking all of those questions and learning as much as we can to make an informed decision about whether or not this vaccine is good for you. I think if someone has allergies, it makes a lot of sense to make an appointment with your primary care provider and talk about it and go through the list of ingredients in the vaccines and make sure it's safe for you. The other questions I hear a lot about are how am I going to know when it's my turn to sign up? But how am I not going to be left behind? And what if I'm traveling or am not in my home community? I don't know that we have all those answers yet, but I think we just need to know that we're all thinking about that as well and trying to make sure that this is a seamless process for people who choose to get the vaccine.
Right. And Rakel, did you have anything?
No, I don't have anything further specific to the vaccine, but, just wanted to say an appreciation to everyone, around, I know we're tired with the COVID rules and protocols, and just, appreciating everyone just hanging in and to keep strong and to, support each other as we keep, going through this COVID pandemic.
Absolutely. And I noticed, sorry, we missed a question here from Miranda. She's saying, let me find it again, sorry. She says, my mom has severe COPD and other health issues. What's her chances and side effects we have to look out for? I don't know if she means if she got COVID or the vaccine. Maybe she would like to clarify.
Yeah, so I would just say to Miranda that people with COPD can benefit tremendously from the vaccine. And so if people with COPD get COVID, it will be can be a big problem.
Right.
And so again, as we know from the trials, the people that got vaccinated, it was safe to vaccinate them, and they didn't get seriously sick for the most part, and no one died. So I think, Miranda, again, this is a great question to talk to your team, to your healthcare team, ask those questions about specific things like COPD, like heart disease, like diabetes, kidney disease. Just talk it through, because once you talk it through, it helps lower everyone's stress and anxiety around the question.
Right. Okay. And yeah, she does say that her mom does want to take the vaccine. So I think you answered that perfectly. And one more question we got here. Why are some people getting bruising on their arm after the vaccine? So I guess that's just like any other vaccine, you would get a bruise, just like when you get a flu shot, right? So
it goes into the muscle.
Right.
And the muscle bleeds easily when you poke it, whether it's a flu shot or COVID shot or any other shot, it can do that.
Right, absolutely. And sorry, one more. We just got Christine Bear. I have an ostomy. I'm sorry, I'm not familiar with what that is. How would it affect me if I get the vaccine? If someone knows what that is.
Yeah, I'll tackle that one.
Okay.
It is not a problem to receive the COVID vaccine for people who have ostomies. So the COVID vaccine is safe with ostomies.
Perfect. Okay, sounds good. And just to wrap up, where could people find information about the vaccine or COVID-19 in general, mainly FNHA for our area or Northern Health? Anything else?
The BC CDC is a great site that I would suggest to everyone.
Okay.
And they also have
Immunize BC is another website as well.
Sorry, what was that one, Rakel?
There's Immunize BC, HealthLink BC. There's all sorts of amazing resources in BC right now.
Right, absolutely. Okay, well, thank you very much for all your time. I know you took an hour out of all your busy days to join us here today, so thank you very much, Dr. John, Dr. Shannon, Dr. Rakel, and Dr. Terri, who I think is away right now, but thank you very much for joining us, and I hope that we answered all of your questions in the live chat, and if you have any more, email us at communications@csfs.org, and we will get those answered for you as best we can. Thank you very much for joining us. Have a great rest of your day and a great weekend.
Bye, everybody.
Thank you all. Bye-bye.